Mammy Mahlong is expecting her third baby. She visits this private clinic regularly and has an ultrasound each time, something she couldn't afford with her other children.
With my first baby, I didn't have the opportunity to have all these ultrasounds. That time, I didn't have a medical aid. A lot of queues. You spend the whole day there at the hospital. You have to book to a doctor, a GP doctor, to go and get an ultrasound. You have to pop out money every time you go to. There are too many women that are not working, and I had a baby at the public hospital.
According to data from the WHO, 69% of global maternal deaths in 2020 occurred in Africa. Most of these deaths were preventable, but thousands of women in middle and low-income countries don't have regular access to life-saving technology like ultrasounds.
Women do not have access to ultrasound, which unfortunately is the bulk of our women who use the public sector. You have to be triaged, and the low-risk patients are seen by midwives, and there's no access to ultrasound. And some of these things can be missed. So you are seen throughout pregnancy. Baby comes out, it's got a spina bifida. No one picked it up because you didn't have a chance to have an abnormality ultrasound at 20 weeks. Sometimes you can get what we call an ectopic pregnancy, where we all assume that we've planned a pregnancy, we confirm that it's there, we are excited, and then you come for your first ultrasound, you are told that the pregnancy is sitting in the tube, which is called an ectopic pregnancy, and it's a life-threatening condition.
As critical as these machines are, they're not readily available to the public, especially to pregnant women, because they're expensive. Thousands of women die every year because they are not getting access to these machines. AI is providing an opportunity for these women.
Some AI applications are already being tested on the ground.
It's really critical for us to see how can we apply AI and tools such as scanning for ultrasound to be able to get women and expectant mothers to get that ultrasound, and the ability to lower the cost is going to really save a lot of lives.
The way we deploy and engage technology is completely different. The West is using AI to improve the service to the served. In Africa, we're using technology to serve the unserved.
AI has the ability to provide more access and affordability. Case studies are already showing improvement, but some governments are still resistant and may need more convincing.